G'day everyone, and welcome back to the channel. So today what I'd like to take you through is how to use Voodoo Floss to significantly improve the health and function of your joints, particularly the ankle joint and the knee joint. Now, a lot of people aren't familiar with Voodoo Floss. Basically, what Voodoo Floss is, it's a really strong, robust elastic band. Very similar to like a TheraBand, but much more sort of tough and thick. And it's been around for a while, and it sort of originated out of the powerlifting community. A physical therapist by the name of Kelly Starrett from the Ready States, ex-Mobility Ward, now the Ready State. He sort of allowed this to reach the mainstream, especially with the help of CrossFit. And the CrossFit community in particular will definitely know what this is, but for the rest of us, and particularly physical therapists across the world, or physiotherapists across the world, we don't necessarily know enough about this, and we don't use it enough because it's brilliant. And basically what it does is, the idea behind this is that you wrap up a joint or soft tissue, really any part of your body apart from your face and neck, obviously. If you wrap it up really tightly, and then you facilitate movement of that area, it really helps shear free any restrictions, any adhesions, any sort of tightness, tight soft tissue. But it can also be fantastic to help flush out any congestion or any accumulated waste. So it comes into its own when we're looking at chronic issues. So when we look at knees, if you've got an arthritic knee or have had a bad knee for a long time, something like this, it can be fantastic to breathe some new life into that area. But as I said, it's not something that we tend to know very much about. So if you're seeing this for the first time, I'll leave a link to Voodoo Floss in the description. You can just see what it looks like. As I said, you can use TheraBand's fantastic, an old inner tube of a bike tire, pretty much the same thing. But the official stuff is fantastic. So how it looks. So we'll do the knee first, and what we always want to make sure we do is that we want to make sure that we do a test beforehand. So for anyone with a bit of a bad knee or a dodgy knee, just try a couple of squats as deep as you feel comfortable. Get a sense of how it feels, whether there's any discomfort, how loose it feels, how tight it feels. If there's any stiffness, if it feels like there's a bit of swelling or congestion there. And all we basically want to do here is wrap it up pretty tightly. So like any sort of bandaging, you can start from the distal area and work up. So if there is some swelling, a good rule of thumb is that you start from the bottom and work your way up so that you sort of capture all that swelling. But we'll just do this quickly. So you want to capture the knee joint. So we want to pull it relatively tight, and then when you're wrapping it over, you sort of want to go over about a half width, and then just keep working your way around. Now, if you're a male, or if you're anyone who has hairy legs, it may not be the most pleasant experience to begin with, but it is fantastic. The negatives sort of are far outweighed by all the positives that come with doing this. So again, you want to make it relatively tight, and the important thing to note with this, and this is where common sense comes into it, so this is sort of like a blood flow restrictive type exercise. So you don't want to do this for 5 minutes or 6 minutes. You only want to do this for 1 or 2 minutes. You want to tuck the end back in there. But the point is that you have it up nice and tight, and then what you do is you take that joint through full range of motion. So what we want to do here is we want to sort of fully extend into that end range, but then also we want to make sure that we're taking it through whatever depth we have for sort of 1 to 2 minutes. And again, with anything that includes flushing out congestion or swelling, we want to make sure that we incorporate movement, because movement gives us access to the only pathway out for that waste through that lymphatic system. So again, it doesn't have to be perfect, but then once you've done that for about a minute or two, we then want to take it off. Now, when we get to the ankle, if you feel like your foot goes purple, or you feel like things start to get a little bit tingly, then take it off. But the idea is that you want to do it tight enough so you feel like you're getting some fantastic benefit. And the interesting thing is, the reason why this is called Voodoo Floss is when you have it on and you're moving around, it doesn't necessarily feel like it's doing a lot. But then when you take it off, it feels like magic, which is a little bit tacky, but the proof's always in the pudding. We only really care about things And we should only really care about things that make a genuine difference. And for me, Voodoo Floss is one of those things that's severely underrated. But it's a huge part of my treatment because it tends to work really well. So what you'll see a lot once you've done this is you'll hopefully see some lines or some markings. It's okay because what we've done is we've sort of temporarily restricted some of the blood flow, tried to shear free any of the adhesions, any soft tissue restrictions. Then when you take it off again, you get this rush of blood back into the area. Sort of reperfuses that with sort of fresh blood, which can help in a number of ways. So again, once having done that, what we want to look at again is we're going to try and do the same movements again. And I'd urge you to try this yourself because it's very hard to take my word for this over the internet and over a video, but it feels significantly looser straight away. And anyone who's ever done this before can hopefully attest to the idea that it feels different straight away. So again, when we do the same thing with the ankle, all we're really doing here, hopefully you can see this, I'm going to start down low, again, relatively tight, sort of overlapping by half. You can do a little bit less or a little bit more depending on the person. And again, if you're doing the ankle specifically, we want to make sure that we're covering the areas that we want. So for me, this will end up being the foot, just because we haven't quite come up high enough. We might still be able to capture the ankle a little bit. Yeah, I think we can get there. Alright, so it's not going to look super pretty, and it doesn't necessarily matter if you don't collect everything, but we want to make sure that it feels nice and snug in there. So pull that up. It's tight. So again, we're looking at the foot. Just pay attention. Don't be silly. If it does look like you've got it too tight and you're really cutting off the blood flow to your foot and your toes, then don't do it as tight. But again, doing it for a minute or two, unless you have pre-existing circulation issues, it's completely safe and can be quite effective anyway. So same thing again with the ankle. Having done the ankle, we want to take it through full range of motion. So that can be in all directions. So again, if you've sprained your ankle acutely, or if you have some chronic ankle issues, this is a great thing to do. Now, if you've injured yourself within the last day or two, you probably want to give it a day or two grace period. Again, everyone's different, but if you tend to wrap up an injured area quite tightly and create this shearing effect through the ankle, you just can't guarantee that you're not going to make that injury worse. But once you're comfortable that the irritation and the acute aspect of that has settled, it's a great way to really speed up the removal of swelling. You know, get that waste out of there so that the pain can go away faster, your muscles can activate again, and you get your function back as best as possible. So again, we want to take it through that full range, whatever you need to do for a couple of minutes. And then when we take that off again, we're hopefully going to see that it feels a lot looser than before. So again, I don't know if you can see this. The colour's a little bit different, probably doesn't show up too well. Again, the colour's returning anyway, but from a mobility perspective, it feels a little bit looser. And then when we squat, that ankle on this side feels a bit looser, as does the knee, which I did on this side. So Voodoo Floss, it's an interesting tool. So for something that's not necessarily very well, it's not very common in therapy today. It's something that you need to do if you want to get back to what you're doing as quickly as possible. Its ability to free up the tissue, chronically stiff tissue or acutely tight tissue, is fantastic, particularly when we're now sort of initiating conversations where we're trying to move away from icing an injury. And I did a video on that a little while ago, and I'll link it up here, but the idea is that ice isn't necessarily or shouldn't necessarily be our first choice to treat an acute injury. It does have some great pain relieving qualities, but the impact that it has on your tissue's ability to heal and the healing process, more specifically inflammation and swelling, it has a negative effect. So despite ice being something that we've used for a long time, and we'll probably still continue to use it's on every first aid course. Every sports star that hurts themselves, they reach for an ice pack straight away. And while we're waiting for that culture to change, we need other things to sort of pick up the slack, particularly things that maybe work better than ice anyway. So if you're looking for ways to get rid of chronic swelling or acute swelling quickly, reach for something like Voodoo Floss. As I said, it doesn't have to be this really thick, heavy-duty Voodoo Floss. It can be a TheraBand. It can be something a little bit more gentle, but has some elastic aspects to it. And again, because we're only doing it for a short amount of time, a minute or two, but we're encouraging movement at the same time, it's a really healthy way to try and regain and reclaim normal function as quickly as possible. So that's Voodoo Floss. As I said, check it out in the description below. Pick some up for yourself if you think it's fantastic. You can get it from anywhere, but it's something that is fantastic to at least be aware of going forwards. So keep that in mind. And as always, if you enjoy what's coming out of the channel, if you like this video and other videos that we're putting out, we'd really appreciate it if you would leave a like below and consider subscribing. It obviously helps these videos reach more people. Scrolling through YouTube, scrolling through the internet, there's a lot of really old school, outdated videos. If you look at all the top videos for most injuries, most sort of physical therapy advice or medical advice, the top videos are generally from sort of 5 to 10 years ago. So I think it's time we sort of update that and start talking about things that still are useful but work, things that you can do and rely on to make a difference when you're trying to conquer your injuries and dysfunction. So leaving a like and subscribing really helps that happen. As the more support these videos get, then hopefully the more people will see them. And we can start to shift that dynamic between, the old school of maybe who just default to ice because it's the thing they've always done, to more new school ideas like Voodoo Floss that a lot of people don't know about. So any help there would be greatly appreciated. But as always, these videos are coming out quite consistently, and just keep an eye out for the next one. But until then, appreciate you watching, and until next time, bye.